please, Dr. Georges-Pascal Haber, CEO of Cleveland Clinic, Abu Dhabi, please come to the stage. Mr. Kensuke Suzuki, the head of new technology, Toshiba, please come onto the stage. And Hasan Al Nowais, the managing MD and group CEO of M42 and chairman of Cleveland Clinic, Abu Dhabi. My esteemed audience, please give them a big round of applause as they take their positions. Thank you very much. Gentlemen, an exciting morning here at Abu Dhabi Global Health Week 2025. Hasan, I have to cast our mind back first of all to the inaugural Abu Dhabi Global Health Week that we were here attending and part of last year. And what would you say is your feeling initially from this morning here?
Proud, excited, energized. It's amazing where you're always positively surprised. But one thing I've been trying to embrace recently is always lower your expectations and be positively surprised, which is what we're living here today. Right? So we're very proud. You know, it's always comparable to Arab health in Dubai. But we are definitely, Abu Dhabi is definitely taking leaps in the right direction. And what we're seeing here today is we are making history.
Absolutely. And as you say, we do often compare to Arab Health in Dubai, which is at the beginning of the year. But here we are in our home, the capital of the UAE. You've just mentioned there that Abu Dhabi is making leaps. It's making history. And the announcement this morning, it really promises to make history, not only for the country, but also for the region. Let's talk a bit about that monumental moment and why you think personally it's going to be significant.
Because of the reason of why it was done, because of the decision that was taken, which always revolves around one thing, and it's our people. Right? This is what Abu Dhabi was always built on, is what's in the best interest of our people. And when you have these genuine intentions to do what's right by your people, everything else falls in place. If I may just put you on the spot for a second. Negotiating with Toshiba was not the easiest thing we have been through. Right? But what I can tell you is because they simply believed in our mission, believed in what we genuinely wanted to deliver to the people of the United Arab Emirates, they have quickly believed that we are the right partners. Abu Dhabi is the right partners. I have to give Maram the lion's share of the credit. She has done an incredible job working with our partners, but I also have to give our partners the credit for believing in us. Because, again, I go back to the fundamental point of the success of this country, 53 years old, was mainly driven to take care of its people. So everything we do here today, whether it being the inception of Cleveland Clinic Abu Dhabi, whether it being attracting new cutting-edge treatments like the carbon ion, is all for our people. It's a simple question our leadership always asks. How can we make our people's lives easier and better? And the answer is work hard, not only to bring technologies, but to bring talent, right? Look around you for a second. Look at the talent Abu Dhabi has been able to attract. Just take a step back. Look at this gentleman in front of me, Stephen Grobmeyer, right? Has been fundamental when it comes to cancer care in Abu Dhabi. Look at this other gentleman, Mumtaz, right? Has been fundamental not only in providing care to our patients, but in genuinely taking care of people, whether it being their own caregivers, but our patients too, who walk into the doors of Cleveland Clinic Abu Dhabi. And then last but not least, this gentleman to my left, right, who joined us most recently. But if Abu Dhabi did not have the right infrastructure, the right landscape, and I always say that oasis of offerings, not necessarily monetary offerings, oasis of safety, oasis of security, right? Oasis of innovation, of transformation. That's what people are looking for today. Trust me, with the people you see sitting around the room, nobody cares about the monetary returns. People care about where can I flourish, where can I grow, where can I build a family. look around you. Abu Dhabi or the UAE is perfectly situated between the East and the West to be able to create that environment to attract the best of both worlds. So I'm sorry, this is a long-winded answer to your question.
No, it's a wonderful answer.
But it's always about our people. It's always about how do we make care more accessible. But most importantly, how do we bring cutting-edge technology and always be at the forefront of it?
And I think that wonderful, comprehensive answer, we really appreciate it because you've given us an insight in terms of the various teams that it takes. But also, we love hearing the behind-the-scenes information about the negotiations. Maybe we can hear directly in just a moment. And we must credit Mr. Suzuki. He's wearing on his lapel a UAE flag as well. So, you know, there is an allegiance. The negotiations worked.
So I can tell you, like I said, they weren't the easiest, but they worked.
We will hear in a moment about those negotiations as well as the technology. But you mentioned there, Dr. Georges, and the pivotal role that he's been playing. Dr. Georges, you and I were on stage last at the World Government Summit back in February. And that was a wonderful occasion for us to share with international guests coming here to the UAE about what's happening in the UAE, but also Abu Dhabi. We celebrated on that stage the 10th anniversary of Cleveland Clinic Abu Dhabi. Congratulations again. On this exclusive announcement, could you give us the perspective from a patient's point of view? Exactly how transformative will it be?
So I'm going to give you the patient perspective. I want to start by saying the physician perspective when they have a cancer patient in front of them. Every physician across the world, they want to provide the best treatment available to their patients. That's it. Carbon ion is the best radiation treatment available. We are putting the best technology in the hands of our physician to provide the best treatment to our patients. So from a patient perspective, being in front of this physician and knowing that their physician is going to be able to provide them with the best treatment is very reassuring to them and to their family. Just imagine a patient, and I gave the example of lung tumor. If a patient has a nodule on a CAT scan, the same day, the patient will be very worried, right? You're telling them you have a nodule on the CT. The same day you can biopsy it, get the result, and get it treated in one session. By the end of the day, the patient came with cancer and leave without cancer. I just want you to imagine how transformational this is on the cancer treatment side, but also from a patient perspective side of the angst that we're taking away, the feeling of hope that they came with something and they left without cancer. This is transformational to patients, not only in Abu Dhabi and the region, but across the globe.
And I think that's really important to emphasize just how transformative it can be, as you say, both giving the new tools for the physicians, but also for the patients as well. Now, Mr. Suzuki, you have already been teed up to give us an insight in terms of these negotiations. So we'd like to have a bit of a behind-the-scenes color, if you may, but also let's delve into the technology involved.
You got me very nervous here already. Talk about negotiations, I think. I think the discussion between ourselves and Cleveland Clinic M42 dates back quite a while. We have been in contact about the interest of employing heavy ion therapy technology into this country goes way back. So we have been doing unofficial, maybe official transaction for quite a long while. But this really came very accelerated, maybe across the year for the last year. During the discussion, we wanted to be very responsible in providing what kind of technology we can provide. Responsible meaning what are the technologies that we have proven out at other sites, other installations across the world. And we have been talking with the technology people as well as the doctors here in Abu Dhabi to say what we can offer as a responsible manufacturer of the technology. So I think that in a sense maybe cause some maybe some nervous situation maybe during the negotiation. But I think all in all, we think the negotiation between yourself and Art went very constructively. It was a very constructive discussion on how to realize this facility. Not that we goes diving into that contractual negotiation, but more very constructive manner in which we said, okay, let's think of how we can realize this within the time frame and within the technology that you want. So all in all, I think there were very tense moments, I think, in the background, but I think all in all, I think it was a very good moment as a result.
I think that's really important to hear from you directly. And simply the reason we're celebrating this, and Hasan was mentioning this earlier, there are only 15 centers across the world. So to hear from you that, all of you, that this is a long process in bringing this brand new facility here. It's to be built here in Abu Dhabi. This isn't simply a case of an overnight deal. This isn't simply a case of just picking anywhere in the world. There isn't one currently available in North America, for example. So for Abu Dhabi to be home to this in the Middle East and for the wider region, this is revolutionary. So thank you for giving us that insight. We must celebrate that moment. Let's please give them all a big round of applause for getting to this stage. All of us who have experience of living and working in the UAE knows that there can be a lot of bureaucracy involved in making sure everything is right and in place, because it should be. And healthcare in particular has a lot of regulations. To get to this stage, it's remarkable. Now, let's have a science lesson, if we may. Let's look at the physics. When we talk about heavy ion facility, what do we mean? Why is that different to other cancer treatments that are available?
Well, you got us all informed with the video that was shown. When compared to X-rays or proton therapy, carbon ions tend to be 12 times bigger than protons, meaning that if you shoot one carbon ion into a cancer tumor, that has a larger biological effect. That being one. The other is that when you employ carbon ions for irradiation, you can actually pinpoint the depth of the ions to the certain cancer tumor, meaning you can actually fine-tune the irradiation to a certain point, provided that nature of carbon ion therapy. Toshiba also employs the technology where we can actually do three things. One is we can do what we call pencil scanning. Pencil scanning meaning we can pinpoint to the tumor, and we can actually paint over the tumor as if we're going to really cross out the tumor. That is realized by our controls using magnetic fields to control the ions. That being one. The other, we have what we call the respiratory gating. Respiratory gating means, okay, patients are lying on the bed being treated with ions, but of course when you breathe, some of these lungs or the organs move. So henceforth, the tumors move as well. What we have, Toshiba has developed across our experience dating to 20 years, is that we can actually have an X-ray working and pinpoint to the tumor, and when the organ moves, we can also have the beam move in accordance with how the patients move along. So we can control not only the painting of it, but also the movement of the organs, so that we can actually get the tumor to be treated very precisely. The third one, what we must say, is that we have employed what we call the gantry system. Gantry system is that we have a irradiation system that we can shoot from 360 degrees across the patients. We don't want to move around the patients too much, because once again, when you move the patients, the organs move as well. So when we have a patient lying on the bed, we want to keep him or her that way. But by virtue of rotating the radiation point, injection point, we can actually set up a treatment plan where we can be flexible in targeting the tumors and so forth. So all these three technologies we have developed in-house, and we have proven out, provided the past experience, and which is what we are going to deliver for CCAD this time. Sorry about my long speech, but
No.
I hope I didn't get you bored.
That was extraordinary. And you know what? We're hanging on your every word because the science involved here is cutting edge, it's groundbreaking. I believe the first facility, you introduced it in 1994, and still 15 around the world. So for Abu Dhabi to have access to this type of technology, it's incredible. Dr. George, to build on what Mr. Suzuki is speaking of there, that pinpoint precision, that type of treatment, the video was explaining that healthy tissue is not damaged. I mean, how important is that kind of idea of just being able to laser focus in?
So being able to be very precise in our treatment, we'll be able to treat the tumor and spare the healthy tissue around the tumor. By sparing the healthy tissue, we're reducing side effects. We don't want to damage any tissue around the tumor. We don't want to damage nerves. We don't want to damage muscles that have a functional effect on the patient. So by being precise, we'll be able to treat the tumor and avoid any side effects.
And I think that's really important to hear about that. Hasan, I'm going to bring you in right now and just speak about the wider alignment of the objectives of this project when it comes to M42's vision that feeds into the vision of the country.
So since the inception of M42, everything we have been trying to do was always done through using technology as an enabler. So for us to be able to attract the best patient-centric treatments enabled by technology is, using your own word, revolutionary, right? Transformational. And we continue to build on that. It's about taking risk, taking calculated risk to ensure that we really want to transform capital into capability, because the perception was always very rich, small country. What are you going to do with the resources you have? And what Abu Dhabi and the UAE has been able to demonstrate over the last 53 years is to really, really invest its capital to be able to attract capability. And capability is, talent is one, but technology is another too. So what we have been able to do is to use the data we have, combine it with technology to come up with the best treatments for our patients, whether it being proactive treatments or reactive treatments, right? So we will continue building on that vision, which is everything we do should and will be enabled by technology. And technology would be at the heart of everything we're doing for our patients. So it perfectly aligns with our vision since day one. And I believe everything happens for a good reason. And for Toshiba to be our partner at this point in time is definitely very instrumental and very pivotal for us.
And I think, again, to celebrate that, that kind of motivation behind the vision of turning capital into capability, I think that really does need to be reinforced here on this stage. The UAE and Abu Dhabi are unique in that. And, you know, the extraordinary, groundbreaking innovations that we've managed to celebrate on many stages, Arab Health here in the inaugural Abu Dhabi Global Health Week, this one, I feel, just takes it to another level.
I think, if I may, we still have some time.
Yes.
I'd like to share the issues I can't say off the record story with the amount of number being here.
That's no problem. I might just ask you to bring the mic all the way.
Sure.
Yeah.
But a story that I have lived during COVID, where a reporter was conducting an interview with me. I think some of my colleagues know this story. And was being quite provocative with the questions he was asking. I was being respectful to the age difference and said, if you're provoking me, tell me so I know how to answer the question. He said, no, I'm being genuine. A 50-year-old country with so much capital, obviously it will be one of the best fighters of COVID in the world because of the amount of capital you have. And my response, no, that's not the case. We have neighboring countries that were established exactly the same time the UAE was established. Leadership came on board the same time the UAE leadership, meaning His Highness late Sheikh Zayed, the founder of the country, and had, if not the same, more natural resources like the UAE. Those countries do not exist today or are unheard of. while the UAE has significantly flourished to become the country it is for one simple reason. Nothing but our people were always at the forefront of every decision our leadership made. So by de facto, we take that and use that same mindset at M42 and say, our people are at the center of everything we're doing. Meaning we have to invest everything that's within our control to attract talent, to attract technology, to simply make people's lives easier. So again, we will continue building on that momentum going forward. We will be very aggressive, very ambitious, aggressive in a good way, ambitious, and taking these leaps in that direction. Because we believe it might take a bit of time, but the good will come out at the end of the day.
I love the fact that we have a platform like this, that we can give time and insight into hearing these extraordinary background stories. And Hasan, thank you for taking us back to that founding vision and where it brings us to today. Mr. Suzuki, I'm going to come to you in just a moment to get your perspective on when you pick a country and a city like Abu Dhabi, what were some of the criteria that you were looking for? We are very welcoming of this technology coming here, but for Toshiba, if you only have 15 centers, but as you think on that point, may I also ask my team if we can have some mics handy? I would also like some of our esteemed audience to give us a little snippet of their insight in terms of the progress here as well. So, Mr. Suzuki, if you may, give us your perspective on why Abu Dhabi.
Why Abu Dhabi? Of course, when we Abu Dhabi is not the only, of course, the medical institution that is interested in heavy ion therapy. Of course, there are many discussions around the world who are interested in employing heavy ion therapy. But all in all, it is really dependent on the, if I may say, the leadership of the medical institution that want to employ heavy ion therapy. Are they really committed to employing the new technology, taking on the risk and so forth, is one of the let's say a very decisive factor in actually making the project realized. I think this Abu Dhabi project is one of the testaments of this actual tendency, I think. So once again, it is not only important as a technology supplier to answer to these questions, but it is more so very important that the potential owners or the potential employers of the technology are on the same boat, if I may say, or committed to actually employing this new technology on board, and to for the benefit of the patients that they're looking after. So. Why Abu Dhabi? I must say, you provided that environment for us to really offer the best of the best to this opportunity.
And we appreciate that insight because I think it is very illuminating. Dr. Georges, I think you might want to come in on that point.
No, I mean, I just want to add that I don't think there is any healthcare system or any country who doesn't want a carbon ion facility. The reason we're able to get it done in the UAE is because of the commitment, not only of the team to push a project forward, but the support from the government. Not only the financial support, but also the regulator support to put the framework around something like this to happen. So this is one, I think the support is very, very important, but also being able, as Hasan said, to attract talent. In Abu Dhabi, the transformation that we've seen in Abu Dhabi in the UAE allow us to attract talent here. Attract talent to not only operationalize this, this technology, but able also to do research and advance the field.
And I think that's a really poignant point because it builds on what Hasan was talking about, people and the talent that's attracted here, but also that collaboration with our international partners. Speaking of talent, and I've already given you a forewarning, can we please get a mic to, yes, madam, speaking of the talent involved, it'd be wonderful to get your insight in terms of bringing this journey to this point. And please introduce yourself to the audience who don't know you.
Good morning or good afternoon. I'm a VP of Investments at M42. it's a great honor to have this project announced today. We've been working a lot to bring it here. But what has to be said is this isn't an individual effort.
So,
Sorry.
yeah, it's an interruption. She's being humble. She has been leading this project to where it is today. So as much as she says she's a VP in the investments team, she has been the force behind what you see here today and what we're celebrating here today.
That was a worthy interruption, and that's why we've given you the spotlight.
Thank you.
So yes.
Hassan also flatters me because it's not an individual effort for this project, honestly. So I work with my partners, Dr. Grobmeyer, Dr. Fadi, but also Ryan, and the support of my team to bring this. And the support is at every level, not just from M42 and CCAD to bring this project together, but from the government and vision of the United Arab Emirates, who have this vision to bring this technology, and it's thanks to them, really, and we have to give a mention to them, but also the supporting entities like the Department of Health and the regulators who are going to put together the framework to bring this technology together. So thanks to the leadership of the country, leadership of the Abu Dhabi government, and leadership of, M42 Hasan, who drove this project really right from the top, and Cleveland Clinic to bring this project together, and to my team who have supported. So to give you some insight, one of the reasons why Toshiba selected us and for this project is the fact that Cleveland Clinic will potentially lead in the innovation in this field. This is a relatively nascent field, and there's and indications keep getting approved. But CCAD will be pivotal in continuing to add indications for this treatment. So Dr. Fadi will lead new clinical trials using this technology. And this is what's really potentially exciting.
Absolutely. And Maram, because I put you on the spot and you've mentioned Dr. Fadi, maybe let's pass the mic over to Dr. Fadi. Thank you, Maram, for that insight then. Dr. Fadi, it's wonderful to hear from the whole team. So a few words from you about how significant this feels for you.
Thank you, Maram, and thank you, Abu Dhabi. Thank you, CCAD. Thank you, M42, for the support and for the vision to bring this technology to the patients of the UAE and to Abu Dhabi and to the region. This technology, as we heard this morning, is a major breakthrough. Is gonna bring us a second generation or third generation of technology for our patients. We are going to be able to offer solutions for patients who don't have solutions or don't have treatment options with the existing treatment right now. This is a major milestone, and it's going to make a big difference in the landscape of cancer care in the UAE and the region.
Fantastic. And would you like to nominate any one of your other colleagues to say a word or two? Or
Ryan?
Yes. Okay, Ryan.
Not expecting this, but thank you. I look up there and see the global collaboration, and I think that says a lot about what's happened over the past few years. And it's with great support, obviously, from the government, Hasan and Dr. Haber really driving this and allowing the team to implement, so to speak. So very much appreciated, and all the working with Toshiba, inviting us to Japan, seeing the technology, introducing and being collaborative across the whole project to date is very much appreciated. So thank you.
Thank you for allowing us to put you on the spot. Hassan, is there anybody else that we should be handing the mic to while we have this opportunity to hear from all of our... You mentioned, gentleman, sorry, Mr. Yes, Dr. Mumtaz. Let's hand over the mic to Dr. Mumtaz as well. If there's any audience members that have a burning question, please do indicate with your hands. Otherwise, we will...
Sure.
Yes.
So,
Yes.
At my heart, I'm still a head and neck surgeon. And I can tell you that looking at it from the perspective of an organizational level and the technology that's available, just a couple of weeks ago, I saw this young lady who had this tumor which was precisely the one for which carbon ion is applicable for. And when I was discussing the treatments with her, we did not have that treatment here because carbon ion is still not functional. And I told her that you would have to go to Germany, to Heidelberg, to get carbon ion for an adenoid cystic carcinoma of the larynx. And that is one of those tumors which is, as much as I love to operate, I would have to take her voice box out, and I didn't want to do that. And I think that's where this technology is going to change for the reason why Cleveland Clinic Abu Dhabi is here. We are here to serve the people of the United Arab Emirates, so we can provide the same kind of care to them that's available in other parts of the world that's not available here. And I think this is another perfect example of how we are serving our purpose to being in this region, with, of course, the collaboration of all the gentlemen that are sitting there.
Fantastic. Let's please give everybody a big round of applause. We put them on the spot, but it's been wonderful to hear from key members. We did have Dr. Stephen Grogmeyer as part of our team earlier, but I think he may have gone for a coffee right now or some very important business. Now, we've only got a few minutes on the clock, so I'm going to give each of our gentlemen here a chance to share some parting words. If I may begin with you, Dr. Suzuki, a powerful exclusive announcement here. Long time in the making, Abu Dhabi being chosen, Toshiba being a powerful partner in bringing this to fruition. What would be some parting words that you would like to share? Is there any points that we haven't covered so far? Of course, there's so much more science we could delve into.
Let's just say, I think today is a very good day to celebrate this monumental announcement. But once again, let me say, we've only just begun. This is going to be a project that we have to execute. And then we have to bring in the first patient, and we have to treat it. So we have to prove it out. So for us, Toshiba, we think, okay, we're going to celebrate today.
Yes.
But this is only the beginning. Hopefully we will deliver, of course, and actually deliver and provide the benefits and show to the world that this is actually something that works and works for the benefit of the people of the UAE. So once again, my simple message is that we've just begun, but we're ready for that.
And I think, therefore, if we have just begun, that means that we must invite you back onto the stage to give us a progress report on how we deliver, because I think even the journey itself is very interesting. So thank you for that. Dr. Georges.
I would say that for those of us who are in the business of fighting cancer, it is a good day for the patient and a bad day for cancer.
Fantastic. I love that. That's the headline. Thank you so much. Hasan, we've built the moment up. Can you give us your parting words?
I think people will not have to go ahead or go forward without hope anymore, especially that Abu Dhabi is bringing technology and making cancer destruction, if I may say, at the forefront of its priorities. People should always have hope going forward.
And I love that note, hope. You began your keynote speech earlier by talking about the emotional impact. And you said that cancer itself doesn't affect one person, it affects the whole family. And I think that idea of recognizing that, but also in everything you talk about, Hasan, people and the family of the UAE, which is very inclusive. We're fortunate that we get a chance to work directly with our Emirati sisters and brothers and have this collaborative international partnership. The UAE and Abu Dhabi, we're very lucky to be on this stage and celebrate this moment. Our esteemed audience, please give our panelists and our key partners a big round of applause.